A very morning to everyone present here at the live session at KIMS Secunderabad. I am your host Pooja, and joining with me are two eminent gynecologists, Dr. Vasundhara and Dr. Nikhila. And today we are bursting a few myths about the common problems in pregnancy, where when in a new mother who's just understood that she is an expecting mom, but she has many doubts. So let us unreveal these common questions, or what she has on her mind. I have a few, plus the doctors are going to be sharing their experiences. So let us have an amazing conversation today. So Dr. Vasundhara and Dr. Nikhila, I welcome you to this live session.
Hi, good morning.
Good morning. And pregnancy. Every expecting couple expects this news, but there are many other unsaid things about it. To unfold these things, we are doing this, common question from understanding of the common situations. So I would like to start with you, Dr. Vasundhara. In your so many years of experiences, any new mother, any couple who's coming to us, they say that they are having tiredness and fatigue, and they are not understanding how to go about it. So how will you help them to understand it?
See, the most common thing is whenever the couple gets to know that they are pregnant, they think that all of a sudden their body changes a U-turn and they think that everything should behave in a different way. If they do not get the vomitings, they tense, they get tense. If they get excessive vomiting, they get tense. Right. And all these so many and so questions which they frequently ask us. The thing is, the fatigueness is one among them. So fatigueness occurs in pregnancy because there are a lot of hormonal changes happening in pregnancy. Correct. So, altogether, like excess generation of beta hCG, progesterone, and all these happen. Progesterone is certain hormone which causes joint relaxation and muscle relaxation. So this actually nature does this because to accommodate the baby, relax the body so that the body gets a space, enough space for the baby to accommodate. So during this course, that part of the body is also get relaxed. So that could be the reason. Many a times they get they kind a kind of weakness, kind of muscle pains, joint pains, and all those. Right.
Dr. Nikhila, I would like to ask you, a new mother, right, expecting mother, is always complaining of heartburn. Okay, in the first trimester, she's not able to eat, she's passing a lot of gases and a lot of burping. Is this very common?
Yes, this is very common. A lot of women experience this kind of complaints because as the also grows. So because of this, everything suddenly there is shift of everything. So all the organs in your body become crowded, and there are some pregnancy, so-called healthy pregnancy foods like apple, pear, otherwise a cauliflower. Some foods which also cause gassing, and because of the hormone, as ma'am said, progesterone, this will also lead to the formation of gas and constipation sometimes.
Okay.
So what they have to do is like eat a small meals more frequently, and after eating a small walk. So will help in relieving gas and bloating.
Okay. So when we are talking about gas and bloating, morning sickness, especially for a working mother, okay, new expecting mother, she finds it very difficult to resume to work. Plus, she is tense whether she can take these leaves or not. So, in during her working hours, how can she manage her morning sickness?
See, morning sickness is the thing, for certain ladies that goes in a simple way.
Yes.
And certain very unfortunate women, they do not experience this at all.
Right.
And for certain ladies that is excessive vomiting is called hyperemesis.
Yes.
That is emesis which is not in a normal way. So all these may cause excessive disturbance, more amount of disturbance to them, especially to the working women, and not even not normal women also. They tend to have a kind of heart burning and fatigueness. Sometimes they may experience giddiness and syncopal
Yes.
attacks. All this because of the lack of food intake, and excessive vomitings may lead to kind of hypoglycemia and all those.
Correct.
So the thing is, most common trick here is empty stomach and full stomach.
Okay.
These two definitely precipitate vomiting. So that is the reason you need to feed like a baby. You need to have a meals like a baby. So
Okay.
as we feed once into every 2 hours for a baby, we have to have minimum of at least 100 ml of any kind of fruit juice, which doesn't cause acid food. We should not consume acid foods. So which may add on to the already predisposed acid reflexes.
Okay.
So if you take a frequent small meals and to have at least 10 to 15 minutes of walk after major meals,
Mhm.
these will definitely help in reducing the vomiting frequency and the intensity.
Right. Dr. Nikhil, I have a very common question. In the first 2 or 3 weeks initially, and the first trimester and the second trimester, many working women travel by different mode of transports. So is it advised? Is it allowed? On a general note, not limited to specific conditions.
Definitely, when the pregnancy is not considered as high risk,
Mhm.
or if it's not a precious pregnancy,
Mhm.
previous history,
Mhm.
her health condition before she conceived. So these all factors we have to consider.
Right.
So otherwise, traveling is not a contraindication, but the means of transport,
Mhm.
whether she's traveling through bus or flight or car, the way of transport is also very important.
As long as
As
the
long as
patient is comfortable,
comfortable,
she
she
can.
And she can take small breaks if she's traveling by a car
Long
and
journey.
for a long journey.
But what about our daily commute to the office?
Yes, definitely. We advise the patient.
Yeah.
We advise the patient to have her activities to work till last day of her period, because that puts her in a kind of a continuous active mood, and which keeps her brain in a constant working way, which doesn't deviate her mind.
Right. So in addition to that, I have a question, where tiredness, overworking, overstress, probably she's standing for a long hour, or she's dehydrated. It can be anything. So if she's having long, her leg cramps are there, longer period of time, her back pain is there. So what is the solution for that to overcome such problems in pregnancy?
Yes, let's
Yes.
physical activity, doing yoga, exercises, Kegels exercises and all, and making herself hydrated
Mhm.
and during the summer.
Rich electrolyte
Rich
fluids,
electrolyte fluid.
coconut water and fruit juices, all
All
those
those
can
can
reduce
reduce
the leg cramps. In pregnancy, lot of electrolyte disturbances do happen.
Okay.
So increase your content, your food content with lots of fresh fruits and either fresh juices without more sugar, and probably with less sugar, and electrolyte rich fluids like coconut water. These will definitely help in restoring the electrolyte balance.
Because in pregnancy there is water retention which
Water
happens.
retention.
Right. But many of them in their later part of the pregnancy, like in the third trimester, complain of frequent urination or emptying of the bladder. And if they don't go to a washroom, because the washrooms are not clean, hygienic, then it becomes difficult for the expecting mother to go out. So in such cases, how should a expecting mother handle this situation?
Urine leak is a very common complaint where each and every mother comes and complains, most in the first 3 months and also in the last
It
3
is
months of
due to physiological
changes.
So,
So because of these changes of hormones, the pregnancy hormones, these circulating hormones, as already ma'am said, they relax the pelvic muscles, muscles which are surrounding the pelvis. So because of this also, they have this stimulation of urine leak while they cough, laugh, or doing some exercises like that. And we also shouldn't remember that the growing uterus will put pressure on the bladder.
yes, especially in the first trimester, the baby will exactly like opposite to the bladder.
Okay.
And in the third trimester, baby comes and tries to accommodate to the pelvis.
Okay.
In these two particular periods, the baby's head, or growing baby or baby's head in the last trimester, will lie up exactly very in proximity to the bladder. So it puts pressure onto the bladder and the frequency increases.
So it's better that they do Kegels exercises every day more frequently.
So that the joints
are
are
more relaxed.
Right. And one more, now
And I think they should also go for a urine checkup.
Yes,
If suppose they're frequent with a complaint about that.
Asymptomatic
Asymptomatic
bacteria
bacteria.
is very important here, because many of the women think that increased frequency is very common in pregnancy and no need to have a urine check. So, but the thing is, asymptomatic bacteria is a certain condition where you need to treat a pregnant woman, though she doesn't have any of the urinary symptoms like any of like frequency,
The
burning, menstruation, and all those, because it indirectly may put pressure onto the growing baby,
right,
fetus,
right,
which may cause the neonatal morbidity and mortality.
Okay.
So, asymptomatic bacteria has to be remembered here. We should not think that increased frequency because of the hormonal
changes are only because of the pressure.
Yes, to happen, and I need not to go to a doctor and get it checked.
Right.
You should have a frequent urinary checkup and if necessary culture, and if needed
Neurotoxins, and then equal
antibiotics.
Okay. Because every woman is in her own mindset, because every woman has a very different history, and she wants her journey to be enjoyed plus have a lot of less stress. But since our lives revolve around stress, so any methods which you can suggest as to de-stress for her day-to-day routine in a way where she enjoys to be in the moment, not to think about the future, how my baby's doing, because it becomes a more stress building up situation for every couple.
See, it is the thing we have to understand that pregnancy is a part and parcel of our life.
Yes.
And we should not think that, no, as I already said, we should not think that in pregnancy we have to have a very cozy thing, and we need to have everybody's attention, and we need to have a particular type of lifestyle and everything. And our family members should also understand that pregnancy is a normal thing as long as it goes in a normal way. And we have to attend, or we have to give attention when it is going in a normal way.
Right.
If we consider in this way, we won't be having any hiccups. But the thing is, attenders and our family members, our husbands, they will be putting more pressure on, you have to eat this, you should eat this.
Yeah.
Yes.
Because suddenly when they have come to know that they're pregnant, everything changes.
Everything
In the family changes,
All the
attention
family's
changes.
attention gets shifted to the
The
mother.
mother.
And they continuously insist the mother to have something around.
Because she's pregnant, it doesn't mean that she has to eat further too.
Yeah.
She has to eat more amount of food. So 400 to 500 calories is enough if the pregnant woman
Yes,
eats.
extra calories are needed in pregnancy, but the thing is, you have to understand the physiological and mind status also. In the early weeks of gestation, she will be having varieties of appetite changes,
Yes.
vomitings and all those. She will not be able to enjoy what she would enjoy pregnant.
Correct.
So if she would enjoy a kind of any specific food, she might vomit by seeing it also, sometimes even smelling it also.
Absolutely.
These are all because of the hormonal changes. But the attendants tend to feed her, something, that if she doesn't use them, they are even ready to put something in her mouth and close that mouth, make it go into abdomen at any cost. The thing is, this attitude should change. The thing is, you have to give some time for her to get adjusted. After that, she definitely will take care of the baby along with their health. And if you put some kind of attention in second trimester and third trimester, which is more nutritious and which help in increasing the baby's weight, and along with that, which is indirectly being reflected with the mother's weight, right? So we can handle it in a easy way.
So, are there any such foods that she needs to avoid during the pregnancy? The first trimester, second trimester?
Only, as in the first trimester is all about
vomiting and it's like what she wants to eat, what she feels like eating is very suggestible, and it's like her eat.
Right.
And we generally suggest that less sweet and less salt, maybe when the pregnancy is progressing, so that there won't be high sugar levels and hypertension and all prevention. We suggest that. Otherwise, all fruits, maybe some have the myths of that they shouldn't have papaya and pineapple.
And I don't know, there are age-old myths.
Whatever we eat, if we eat in a limited manner, it is okay for the pregnant woman. It is advisable.
Enjoy your food.
Enjoy your food.
Enjoy your food. Enjoy your activities. Enjoy your work. And do not put stress on yourself. And family members should not put stress on the pregnant women. If all the things go in a smooth way, everything will become.
Instead of thinking
happy
negatively, what is going to happen tomorrow or in the near future, how she's going to deliver, I think positively, if she enjoys today, could have a better effect on the baby.
I agree. And getting to this point, especially when it comes near the checkups, this is a very strong point by me. In our experiences, when we see the mothers who are coming for a checkup, who have a scan, they are so tensed, and they have probably if they have long waiting hours for the scan appointment and then to see a doctor and to collect the reports, they might not eat on time also. And they don't eat on time, and then they tell you that I'm having fatigue, I'm having a little nausea. Things are very, very different for us. So in such situations, what do we tell expecting mother, and how do we manage this situation?
We usually always advise to carry a portion of snack, whenever they come to a visit or whenever they are traveling out. So it is because they won't be getting their choice of food at any places. We do not know how where will be the doctor by the time we reach the clinic, and she would be in her theaters, or she would be in her rounds, or any other work she would be engaged.
Right.
So in that situations, we have to have a small
Our own
portion-
snack
our
box
own
with
snack
nuts,
box.
some kind of fruit or fruit juice, carrying a water bottle along with them. It's better. It's a good idea.
It's a good idea.
Yes.
Okay. And they always prefer outside food also. So
Those
Swiggy and Zomato is also there.
these are called pregnancy cravings. There is a myth that if they doesn't satisfy these pregnancy cravings, they think that the baby is hungry post delivery.
Yes.
So this is like it's absolutely wrong, because you can succumb to the pregnancy cravings once in a while. Binging on these unhealthy foods, I said that sugar levels may go out of control and you might put on unnecessary weight,
Yes.
which is not worth it.
So, and what is your take, when if a mother has, maternal obesity already, or if she has had a very different kind of conception, it could be IVF, IUI conception. From her diet point of view, what care she should take, and how overall health outlook. how it should be.
Especially when the women has been categorized into a high risk pregnancy, they will have their own set of diet plan,
Okay.
because they have to prepare in all ways for a preterm delivery. If that might happen at any point of time. The doctor would be warning regarding the preterm delivery for them from the conception itself.
Okay.
But the thing is, they have to be in advance, because if delivery happens in a preterm, then the baby has to be having an adequate weight, so that neonatal outcome will be better.
Correct.
So if we have to have a high protein rich diet always, it is advisable to go with eggs if they are a vegetarian, egg eating person. And there are so many vegetarian protein rich diets too.
Right.
So if we stick out to the protein rich diets along with your own choices, so we can have a adequate, well growing baby inside, and we can handle the situation if anything happens all of a sudden.
Right. When you're talking about high risk pregnancy, taking care of oneself becomes difficult in the last few days. Sleepless nights.
Yes.
Or, in the 7th month, 8th month, you have to sleep on the right side, you have to sleep on the left side. There are so many myths around it. So, can you clarify on to why the sleepless nights start happening, and which side are we supposed to sleep?
Usually we suggest left side, because this will relieve the pressure on the blood vessels because of the size of the uterus.
Okay.
So we generally suggest it on the left side, but you can also sleep on the right side also. So only sleeping on the left side may give them neck pain, back pain sometimes. So they can sleep on the left
They
or
can
right
sleep
side.
on any side, but the thing is, according to the anatomy, blood vascular supply, we usually ask them to sleep on left side, as Dr. Nikhila said. It relieves pressure on the blood vessels and increase more amount of blood supply to the uterus.
Okay.
So in that reason, especially for high risk patients like preeclampsia and when we are anticipating a preterm delivery, so we usually ask them to be on more up towards the left side.
Right.
But the thing is, the thing should not be considered that we should not sleep on the right side.
Right. Yes. When we are talking about sleepless nights, we have binge eating also coming into the picture. So most of them choose snack items or baked items, which has high salt content. But as you rightly said, proteins would be much better. So any protein-rich foods which can help the mothers to, carve their cravings, and which will help them and give them a relief at night.
They can have a cup of milk with some protein powder. They can have nuts.
Okay.
Sometimes a banana can also be.
Okay.
Though it is a carbohydrate rich, but it is very good source of
because it has good fatty acids, good fats in that.
So that will help them to put themselves to sleep at night. Yes. And what about being on Instagram and Facebook at night? Use of mobile phones.
That we cannot stop from doing that. So it's better that if they don't watch their mobile, or screen time should be less. Most in their lives.
As a whole, the screen time should be less, it indirectly puts pressure on the baby as well, right? So according to the studies and whatsoever maybe from our Puranas, what they say is whatever mother does, the baby always tries to grab. Yes. So whether whatever the music we hear, what the science has also proved that baby also listens simultaneously.
Right.
So whatever we are enjoying, the baby would be also enjoying. So we have to have a mind in that. A kind of notice that we shouldn't put much pressure
Right.
on the baby.
So nowadays, many couples, to be couples, are choosing towards the total garbhasastha. Okay, making them listen to meditative music, do some good yoga, making the mother relax in a soothing environment. So, what is your take on that?
So it is a very good thought because instead of watching mobile, Instagram, and everything, if they can do meditation or read some books like how they going to chant. In Garbhasanskar, they're going to explain about this all Ramayanam or Mahabharata, and they're going to do some cultural, spiritual vibes, most of them. So this is like only to improve the mental health of the coming baby, going to come child.
Oh, you are for these traditional methods and
So
definitely
they keep them positive. Their attitude will go through towards a positive side.
So I think we have busted many myths out. We spoke about a variety from stress, lifestyle, diet, and taking care of ourselves. So I thank you both for joining us for this session on understanding the common problems in pregnancy. Because it gave us an overview of how to handle a situation right from morning sickness till the last trimester. And as you rightly said that precious pregnancies need to be handled with care. And communication is the key when it comes to precious pregnancy. So thank you for
Thank you.
for joining us for this.
Thank you, Pooja.